Hi, everybody. We're going to start in just a minute or so. We're going to give more people a chance to join.
So while we're waiting, if I may, I want to just give a shout out to Rebecca and Lisa for doing such an excellent job of putting that whole event together. I know it took a lot of you, but we really appreciated these two who are here tonight. Um, they're great leaders, and I appreciate him a great deal.
Well, thank you, Sandra, but it was definitely not just the two of us. It was an
No,
arm. It
couldn't.
was an army of people who pulled that together. So, but we appreciate your words.
Also, we appreciate the support of our partner chapters like St. Croix, River Valley Indivisible, that Sandra represents, and North Metro and West Metro and Northeast and all. It's a it's a great, big, beautiful team that we've got going of Indivisible chapters.
And I'm going to give a shout out to a brand new chapter that has just been formed, I think, in the last few weeks near Malacca, Minnesota. My brother's on, and his wife, my sister-in-law, and others have formed an Indivisible chapter in teeny little Malacca along the Rum River. So,
Good.
yeah.
All right. Well, I guess we can get started. Looks like we got a good group here. So hi, everybody. I'm Lisa. I am one of the co-leaders of Indivisible Twin Cities, and I thank you for joining us tonight. We're going to talk about Medicaid, what these cuts that are being planned by the Republicans, how they're going to impact people, and how we can hopefully fight against that. Uh, for those of you who might be new to Indivisible Twin Cities, I'll just give a quick rundown on that. We're part of the larger Indivisible National Organization. It's a grassroots progressive organization, and we've been kind of in the news a lot lately. Um, Weird, but Indivisible Twin Cities kind of came about January of 24. Okay, yeah, it all runs together. We had many of us had been in other indivisible groups, smaller groups around the Twin Cities. Like Rebecca and I were both in Jordan. We were all with Indivisible St. Paul. We merged with two other groups to create Indivisible Twin Cities, which basically, as the name would imply, and includes Minneapolis, St. Paul, and what we consider kind of the first ring suburbs. Uh, Indivisible in general has just been going through massive, massive growth since Donald Trump was elected the second time. And so there's new groups that are literally popping up all the time. And we are not territorial in any way, shape, or form. We're happy about every single group that's joining this resistance. We welcome them. We want to help them, work with them. They can help us. So we're all allies in the same battle. So you may hear about a lot of different indivisible groups, and it may seem confusing, but it's kind of by design. It's a grassroots organization, and you can organize in your neighborhood, you can organize in your town, you can organize in a metropolitan area like we have. So it's all good. It's all working, and we just are so happy that so many people have joined that movement. So we'll get on with it now. I'm gonna turn everything over to Mike, who is going to introduce himself and tell you a little bit about himself, and then move along with our program.
All right, great. Hello, everybody, and thank you all for joining us. I'm going to try to see as many of you as possible. There we go. So, I'm a physician. My name is Mike Aylward. I'm a primary care doctor, and I work in a federally qualified healthcare center. So what that means is I see a lot of patients who are on Medicaid. And the clinic itself basically is a safety net clinic that requires Medicaid to exist. So this is something that's kind of very important to me personally. And so what I wanted to do is to try to bring people together and get us all on the same page with regard to understanding about what Medicaid is and what it is not, as well as the impacts of the cuts. And then lastly, and most importantly, what it is that we can all collectively do about this. Because I think the key messaging here is that while the Republicans are in charge of the Senate and the House, it is very close. And that if we can flip a couple votes here, flip a couple votes there, then we can stop a lot of pain and suffering from happening across the country, let alone in Minnesota. So I'm going to start off by doing a presentation and just talking a little bit about Medicaid, what Medicaid is, and this is, fairly interactive. And then we're going to have a little bit of a question and answer session, again, to get everybody on the same page. And then we're going to be breaking out into breakout rooms, and it's going to be breakout rooms based on kind of how you interact and identify with Medicaid and the healthcare system. So, are you a physician or a nurse or somebody who's doing direct patient care? Are you involved in public health or administration? Are you a patient? Are you a family or caregiver? Or are you just somebody who's really fired up about this and says, I want to get involved? And what we're going to do is we're going to really think about what it is that our communities that we know and interact with need in order to get activated and to actually put pressure on the legislators. So it's going to be razor focused on changing the minds. This whole presentation is really about changing the minds of 4 people in Minnesota. We're going to talk about that in a second. So I'm going to share my slides here. And yes, I do have slides. There we go. And just by way of background, as I mentioned, I'm a physician, and I work in a federally qualified healthcare center, but I also volunteer on the board of an organization called Minnesota Doctors for Health Equity. And if there are any physicians in the group, contact me, and so we can talk more about this. But as part of this, we are part of a coalition. I saw Laura Mortensen here, who's on that coalition for the Minnesota Budget Project. We're part of a coalition that is kind of working to bring people together to defend Medicaid. The This is Medicaid Coalition was kind of where it started. And so been working on this, and some of the information and slides comes from this. There's a lot of policy work that's coming. But what I'm going to be presenting today is really laser focused on change. Okay. So typically a slide like this or presentation like this starts with what is Medicaid? And I'm not going to do that. I think there's sometimes too much focus on this question. I think the real question is who is Medicaid? And I think the stories we know are stories would take the day when it comes to convincing colleagues and community members and legislators as to what the right thing to do is. And so I think stories are key. We're going to talk about the actual components in a little bit, but I think the stories are important. And so I believe we have somebody in our audience who is interested in telling a story. She said she was running a little bit late, and I don't think she's here yet. So we will continue on. So I'm going to tell a couple stories of my patients, and I want to tell you about how Medicaid has impacted them and how it has, as a physician, it lets me take care of patients. So Thomas and Stacy. So Thomas and these are true stories. By the way, I got permission from my patients to tell these stories. I think that's really important when we're telling stories that they be either our stories or the stories of somebody we got permission from. So I got permission from them. So Thomas worked in construction for many years, and his father ended up having a heart attack and dying. And of course, he got very concerned about this and came to see me for a cholesterol check. When he got his cholesterol checked, he was fine, but it turns out as part of screening, he was found to have hepatitis C. So he had a blood transfusion many years ago because of a car accident, and unbeknownst to him, he'd been living with this virus in his blood, in his liver for many years. Hepatitis C can cause permanent liver damage. It can cause cancer. People die of it. However, recently, it is curable. And we were able to get him treatment for the hepatitis C through the clinic. And really, it was only because of Medicaid he was able to afford this. So he was treated for hepatitis C, cured, and that means that he didn't get it. He's not going to get cancer. He's not going to get cirrhosis, and he's not going to pass it on to anybody. So he was just seeing me yearly, and he ended up getting diagnosed with this rare bloodborne condition. For those of you interested, it's paroxysmal nocturnal hemoglobinuria, big mouthful, but basically it's a blood condition that he would die from if not for some very expensive chemotherapy-like medications that he needs to be on for the rest of his life. And again, Medicaid allowed this to happen, and he was able to continue working throughout this process. Stacy, on the other hand, I met her in an exam room one day, and I walked in, and the best I could describe her was I saw the husk of a human being. There was somebody who's sitting there with no emotional expression. Her eyes were dead. She was exhausted. She had been homeless. She had been trafficked. She had been addicted to heroin for many years, and she had hit rock bottom. And so she came to us after getting involved with some social services that allowed her. So Breaking Free specifically is a group that works with people who are trafficked. And we were able to get her insurance, get her started on treatment for mental health and for substance use disorder and for a few other medical problems that we identified. And now she's working. She has her own home, and she has been wildly successful. And now I just see her once a year for a visit. And so I think these stories are incredibly important to recognize that it's not just the system that exists, but it's actually individual human beings who are impacted. I'm going to pause for a second and do a quick check to see if Caroline's here. She is. So I'd like to introduce Carolyn McGuire. She has a story to tell about her experiences with Medicaid. And so, Caroline, if you want to go ahead and tell people what you were interested in sharing with us.
Sure. Hi. Thank you so much for the introduction. Can everybody hear me okay? Yes. Okay. I prepared a speech actually to share at the rally. And then, of course, as everybody knows, a lot of the speakers we had to change things on the fly. So Lisa had asked if I would go ahead and read what I wrote for that. But I can just start off before I read that, explain. I'm a mom of two children with disabilities. He has my son who's Colin, his name is Colin, and he's 5. And his impairments are much more severe than his older sister's, totally unrelated. But my son incurred a brain injury in utero, and we didn't really know that anything was wrong until several months later. And then our daughter Madeline, who's 11 now, I knew something wasn't quite right from birth, but I was, of course, brushed off for a whole year of worry. And as it turns out, she has a chromosome duplication, and as a result, has low muscle tone, learning difficulties, behavioral issues, all kinds of things. So I didn't start the journey on applying for Medicaid until my son was born. And it took about a year to get everything figured out to even apply. And I am someone whose parents live close to us. My husband is extremely supportive. I have a full village, and it still took me a really long time to get through all the red tape and all of the barriers and all of the burden of proof that I had to show in order to even qualify. So if anybody ever has any questions, I'm an expert. But with that, I will just go ahead and read what I wrote. Yeah. In the early morning hours on Thursday, May 22nd, 2025, House Republicans passed their One Big Beautiful Bill Act by one vote. One. Hidden in this bill is the biggest cut to Medicaid in history. Any single one of our Republican representatives from Minnesota could have stopped this, but none of them did. Why not? Why didn't you step up and show up for us, Tom Emmer, Michelle Fishbach, Pete Stauber, Brad Finstead? Has the hyperfixation with Democrat versus Republican, red versus blue, MAGA versus the rest of us caused us to lose sight of the fact that we are all human beings who are more often than not very much want the same things? Will we ever agree on everything? No. Do we all have different ideas on how to do things? Yes. But can we please just start with what we all do agree on? We all want our families and friends to live as good of a life as they possibly can. Isn't the right to life, liberty, and the pursuit of happiness really what it's all about? This so-called big, beautiful bill is actually a minefield in our midst. The green grass on top makes it look safe and well cared for, leaving the masses unsuspecting of its hidden explosives below. The destruction and devastation only becoming apparent when we try to cross, doing nothing but trying to make it safely to the other side. And by then, it's too late. We can't fix or prevent explosions we can't see. It's the job of our representatives and senators to see what we can't, lurking below the surface. It's their job to know line for line what's in these bills and how it will affect the rest of us. We choose and entrust them to be our voices, not to silence and ignore our cries for help. I can't tell you everything that's in that bill, but I have read enough to know that buried under pages and pages of paperwork, it's filled with policies that will harm my children and yours. It will take away services, therapies, medical care, and protections for all of us. It will sever the single greatest lifeline that 1 million people need. No, protecting Medicaid is not enabling a bunch of freeloaders. This isn't wasteful spending. In fact, everyone has already paid for Medicaid. Reallocating our money for anything else and to anyone else is embezzlement. This is not okay. My family, my children will not be okay. The therapies that will help my son, Colin, who has cerebral palsy, to learn to walk and talk are covered under Medicaid. His wheelchair, stander, bathing equipment, high chair, leg braces, I could go on and on, all Medicaid. My daughter with her chromosome duplication, all of her therapies, Medicaid. Their IEPs, aka Plan for School that helps kids with disabilities, Medicaid. Do not be fooled. The majority of children and families who use Medicaid are just like my kids and my family. I certainly would never consider us to be freeloaders or people who are abusing the system. Please think of my babies and our lives the next time you vote. Medicaid should have support from all of us, regardless of party and our differences. Injuries, illness, and disabilities don't discriminate, and we all will be old someday. You never know when your family member may need a helping hand. People should not have to rely on a GoFundMe to be able to afford equipment and care that is needed to live. Health and quality of life should never be on the table, nor left vulnerable to be bargained with. We are real people with real problems that we did not create. 46% of all births are covered by Medicaid. Children alone make up 40% of Medicaid users and are only responsible for using 15% of the funds. My children have just as much right as their typical peers to enjoy their lives. They have a right to an education and to live in the comfort and safety of their own home. Yours do too. We can't change the way they came into this world, but we can change the way they live in this world. We have Medicaid to thank for protecting those rights. This is America, for crying out loud. We all work hard and want to live in a country that takes care of its own. I will have your back, and I hope you'll have mine. If your house is on fire or your child goes missing and you need help, we spring into action. No questions asked. We don't wait to find out if you're a Republican or a Democrat first. We don't ask if you are jobless or if you go to church on Sundays. Why should the help, safety, and support that Medicaid provides be any different? We as a country have the resources and then some. Heck, it's bought and paid for the people, by the people. We will not be exploited and taken advantage of by those clawing their way to the top, trying to win the affection and favor of the DuPonts and Rockefellers of the world. Aristocrats and royalty don't get to run the show anymore. That is so 1775. Been there, done that. No thanks, no kings. Have we forgotten who we are and what we hold dear? We are a people who value a backbone over a wishbone. We find strength in being a team. We pride ourselves on rising to the challenge time and time again, regardless of the adversity that lies ahead. We stick together and stick it out because we know in our heart of hearts that's the right thing to do. We hold ourselves to a higher standard because we understand the difference between good and great. We must be a people that values our children and quality of life over greed and perceived status. And remember, as one of our late and beloved Minnesotans once said, we all do better when we all do better. Thank you.
Thank you, Caroline. That was lovely.
Of course. Thank you.
All right. I'm going to go on to slightly less inspiring business, but we'll circle back to inspiration, I promise you, towards the end. So I wanted to take a few minutes and to explain so everybody has in their tool belt an understanding of what we're talking about so that we can use the same kind of shared mental model that we all have to get people to change their minds. So, what is Medicaid? So, Medicaid is health insurance. It is health insurance that is sponsored or paid for by the government between the states and the federal government. I think it's important to recognize that Medicaid is health insurance for people who essentially nobody else wants to insure. The role of government is to make sure that nobody is left behind and that we can't rely on capitalism and private industries to care for people and to provide their care when they can't make money out of them. And the reality is that's the role of government, is to make sure that everybody has a common basic standard of living. So Medicaid is health insurance, but it happens to be health insurance that is efficient. So Medicaid has much lower administrative costs than essentially any private insurance. And what that means is for every dollar that we spend on Medicaid, more goes to medical care and goes to patients, and less goes to the administrative overhead. So if you look at the administrative costs for Medicaid, it's around 4% for those of you who are wonky, and it's around 7 to 15% for places like United Health and other organizations. It is effective. Medicaid has been shown to decrease death and decrease the risk of death for people on it. This has been shown repeatedly. And it's not just that insurance does this, that is true. It's that Medicaid explicitly does this with a very high risk population that has a lot of medical and psychosocial issues that need to be cared for. Medicaid is transformative. It's probably the most successful anti-poverty program in the country. So it reduces poverty, it maintains employment, it improves school outcomes for children, it decreases medical debt, and it stabilizes the safety net. So when you go to your clinic or you go to the hospital, especially if you're in a rural area or an underserved area, without Medicaid, those resources do not exist. So in Minnesota, Medicaid is known as medical assistance. So Minnesota, it's the largest single source of health insurance in the country. So there's no larger insurance than Medicaid. But it's known by many other names because there's this prepaid medical assistance program, PMAP. So Health Partners, UCare, Medica, Hennepin Health, United Healthcare Program, all of these have Medicaid components to them. And so many people, and perhaps some people in this group, but many people in this state have insurance through these programs and aren't completely aware that they are on Medicaid. So while there are barriers to getting on Medicaid, right now it is once a year, somebody comes in, shows their ID, has proof of income, and then they get the insurance or they don't. And if they do, they get it for a year and they re-up in a year. So it's basically like another health insurance plan with an income component. That's going to change in the near future if these bills are passed. So I want everybody to do something right now. We've been talking about this for a little while. So I'm not gonna ask you to show your insurance card, but everybody take out their insurance card and just look at it. You don't need to show it on camera or anything like that, and just look at it. So here's my insurance card. Nobody take a picture. There you go. I don't know if there's such a thing as insurance fraud, but if your insurance card has Medica on it, as many of our patients do, You have to go down here to the care type and see that it's Medica Minnesota Care or Medica Medicaid. So I really think that there's a fair number of people in various parts of the state that are walking around with these insurance cards, and they feel like they're on Medica when they're on Medicaid. They think they're on Health Partners when they're on Medicaid. And I think that's an important thing so that when we use language, we're talking about medical assistance and these specific insurance programs that people may be on. So Medicaid in Minnesota, why does this matter specifically? So Caroline mentioned some of this, but there's lots of statistics on children, people with disabilities, elderly, people with mental health and substance use disorders, being on Medicaid and benefiting from them. This is national data, but it's also true. The statistics pretty much hold up in Minnesota in terms of the proportion of people on Medicaid who receive services. Medicaid is ubiquitous in Minnesota. So this is a chart of the different counties in Minnesota, color-coded. The darkest color set is 32% of people in that county are on Medicaid or CHIP, which is a childhood version of it, down to 14% being the lowest. So if you look around the state, there are significant counties, or there are counties with significant number of people in them throughout the state who are on Medicaid. And this includes children and people living with disabilities, as well as people in nursing homes. Oops. And that was a link that I made, which totally messed up my slide. Where'd it go? Sorry, everybody, I'm back. I was being very clever and had a link, and it took me away. Okay, so at the federal level, there are, as mentioned, cuts being proposed to Medicaid, first at the House and now in the Senate. And I think there's a lot of kind of details we can get into, but we're not going to because they are all cuts. By any other name, they are cuts. There's $800 billion that is being removed from the healthcare system. And there's no kind of easy way of kind of parsing this. There's no fraud, waste, and abuse that's being called out. These are cuts to people and to providers. So the cuts are coming in two forms in the House bill. They are through paperwork requirements, more commonly known as work requirements, but 70% of people on Medicaid are already working. And so this is basically just forcing people to prove that they're working twice a year, with essentially the goal being that the administrative barriers are so high that people just fall off the rolls. The goal is to essentially let people be paperwork to death and to not be able to continue to get care, despite the fact that they're already working. So that's one version of getting cuts. The other version, and this is now in the Senate, it's kind of horrifying, but they are constraining how states are able to provide funds for Medicaid. And so in total, this means that not only will people be taken off the rolls, but if the Senate package passes, that actual care will be decreased and reimbursement will likely go down because of the volume of cuts. So what if that happens? So like I said, the Republicans prefer to use the term work requirements because it polls well, because people in the United States feel that you need to work to deserve to get things. But if you use paperwork requirements, it doesn't poll as well. So Republicans use work requirements. So if you look at statewide, the number of people that are impacted in Minnesota, it's about 436,000 people who would be impacted by these reporting standards, many of whom would end up getting kicked off the rolls. The last thing I'm going to kind of mention is, as Caroline so kind of evocatively mentioned, there are four people who this decision is entirely on them. So Representative Finstad, when he votes to get rid of Medicaid, he's affecting 51,000 of his constituents. Emmer, the same. Fishbach, 60,000. Stauber, 65,000 of their own constituents are going to be impacted by the decisions that they make. And those people in those districts need to say no. And that's what this whole discussion today is about, is laser focused on these 4 people in districts 1, 6, 7, and 8, and putting pressure on them so that they vote no. So how are we going to do that? Well, some resources. So I saw in the chat that some people were interested in sharing stories. So we will figure out how to send these links. I know this is a presentation. We'll get these links out to folks. But the Minnesota Budget Project is collecting stories. And so for those of you who have patients or family members who want to share your story, going through them is a way of doing this in Minnesota. And again, I'm laser focused on Minnesota. Yes, there's a national thing, but there's the 4 people in this state that we need to impact. Providers, if you're a physician or a healthcare provider, excuse me, not just physician. If you're a healthcare provider, Bernie Sanders is asking for stories to be submitted for some purpose. Presumably he's going to read them. And so you can click on that link to submit your story if you're a healthcare provider. Again, we'll get these links out to people somehow. And then there are toolkits. Both This is Medicaid has a toolkit, which I've linked to here, and Medicaid Matters, which is the Department of Health and Human Services toolkit here in Minnesota, has a toolkit with lots of information, resources, social media campaigns, stories of patients. If anybody's interested in this, there are these things. And the reason that I think it's so important to have this group together is that each of you, there's 74 people in this meeting, you all represent an individual, but you are also part of some indivisible group. And I'm asking that you kind of lead up and out, leading up by getting the rest of your indivisible group on board, sharing some of these toolkits and getting them fired up to kind of force the representatives to vote no. And then out, meaning talking to colleagues, talking to people in order to do the same. So the next step. First of all, I'm going to stop. I'm going to pause for a second. And I think we can do this with 72 people. And I'd like folks to ask questions here. And Lisa, you raised your hand, so go ahead.
Well, I've just been monitoring the chat, and we've had several questions about how this is going to impact rural hospitals.
Yes, thank you for that. So it's going to have a significant impact on rural hospitals. One, because Medicaid itself, because of those percentages, a large percentage of the patients in these areas are going to either federally qualified healthcare centers or rural hospitals. And so anybody who goes there now who goes there who is no longer in Medicaid, the hospitals get nothing. And they are on a razor margin. So the projections are that many of the hospitals are going to end up having to be closed. The numbers are very kind of wishy-washy, but there's going to be a significant decrease in impact in terms of, or excuse me, a decrease in the number of people, rural hospitals that are available. 3? Are there 3 rural hospitals that are closing? I don't know what that was referring to, sorry. Other questions? Or for that matter, comments. I mean, we're going to talk as small groups, but if there's anything I missed, anything that anybody feels is important for everybody to know?
I have a question, Mike.
Sure. I'm not sure who's speaking, but go ahead.
It's
Oh, sorry.
Rebecca. Yeah. So some of I don't know what the breakout is here on the we have like 75 people on the call between the Twin Cities and people outside or in one of those 4 districts that you're talking about. But I think one of the things we have to figure out, correct me, is if we are in the Twin Cities where it's quite likely that our representatives are going to vote no on these Medicaid cuts or on that big bill, what can we do to influence these other 4 districts?
Yes. So that's a great question. I think one is the stories piece. I mean, stories are powerful, so making sure we're collecting and sharing stories. The second piece is that's very much what the breakout rooms are going to be for. I think that the question really is going to be what are the messages that will resonate in different people's communities? And as part of that, what are the things that people outside of those communities can do to help people within the communities? And I think that's very much what we need to answer today as part of this. Addie, you had your hand up. Why don't you go ahead?
You. This is my first time joining one of your things, so I'm still familiarizing myself with everything you guys do and I work on. Thank you for everything that y'all do. Sounds great so far. Um, as far as like legislative bills regarding like medical assistance in Minnesota, I'm just curious if you would be able to speak on if your organization has been putting any focus on the Senate Bill 0142. So for context, that is a bill that is aimed at providing MA for disabled people who are employed, and it removes those limitations of like where you can only earn so much money, therefore ending the, as I call, government sanctioned and enforced poverty of disabled people. Um, I find that that's not getting talked about a lot this legislative session, which is really disappointing just because there's so much talk about cutting Medicaid. And also I feel like that deserves a spot in that conversation because I feel like there's a lot of when you talk about Medicaid cuts, people say, "Oh, well, they're not paying taxes. They're not providing anything, especially in regards to disabled people. They're not giving anything back. They're just taking from the system. They're just taking money." And I feel like that's a really good argument to counter that as, okay, well, let's let them work and have MA because they can provide, they do get money, then they do put that money back into the economy. I'm just curious if that bill is on y'all's radar at all.
So to be honest, I'm thinking perhaps that is for some people in this group. I am not as focused on individual bills as this kind of overarching destructive mechanism of passing this BBB bill. Um, I'm less of a policy person.
No, I appreciate I'm very brand new to getting involved in policy
No,
stuff, so
totally.
I'm still getting my bearings. So no, I appreciate the
Absolutely.
transparent answer. Thank you.
I can jump in on that a little bit. And we just within Indivisible Twin Cities more generally, now that the legislative session is over, we're in past legislative sessions, we've been kind of hyper focused on what's happening there, but this one was a little different, partly because we are so overwhelmed by what's happening at the federal level. So that's just also a reality of the environment the political environment that we're working in right now too. However, we also have teams that are focused on calls to action and tracking specific issue areas. And so we would love to have you engaged in those efforts going forward, especially if you have, specific bills that you're interested in. And yeah, we definitely love your input there.
I appreciate that. Thank you so much. And I know there's other people with questions. I did have a second question, and this one's less personal and more just client based on clients that I work with that has been coming up recently. I know there was a recent bill passed within Minnesota, and I know y'all aren't geared towards specific bills, but that's affecting undocumented adults receiving MA. I'm curious if y'all have any information that y'all can share clarifying that. Specifically, I had a situation occur this week where a care coordinator reached out to me asking if I had info on ad undocumented adults who are, I say undocumented. I'm not really good at the correct terminology there, and I'm still working on that. Um, Somebody who's an asylum seeker who does have a social security number who is trying to get MA, and they're very concerned now with this Minnesota bill passing that they won't be able to obtain MA anymore, and therefore they won't be able to get services for their child. If you have any resources or info on that, I would really, really appreciate that, just helping clarify that.
So that it's a very good point. So that it's Minnesota Care that was the piece that was removed, and people who are undocumented are essentially being as of today no longer being able to apply and are being kicked off of Minnesota Care as adults. Um, and that is a problem because if you are undocumented, then you can't apply for medical assistance, which is, a trope that the Republicans have tried to pass to talk about, which is that many people who are undocumented or illegal are on medical assistance, and that's just not possible. So we deal with this all the time. I would say if your patient or client has a lawyer, federally qualified healthcare center, clinic, social workers in this clinic can help with that because we deal with that kind of thing all the time.
And let me just jump in real quick on that. One thing to keep in mind is that that does not go into effect until January 1st of 26. Not that it's
Um,
any better, but
no, people are
is
getting
that
kicked
not the
off.
case?
No, it's
Oh,
people are there's right now there's no people who are no longer eligible as of today.
oh, okay. Well, I
Um,
stand corrected.
there's some people who mentioned things like not, perhaps appealing to people's better graces with stories may not be effective. I completely agree with you, and I think the main idea here is that the stories are to motivate people to basically tell their representatives, we're not going to vote for you and you're going to get kicked out. I mean, that is essentially the only thing that they're going to respond to, and you are 100% correct. Anne, go ahead. You had your hand up for a little bit.
Oh, just to say that I absolutely applaud everyone who's really working hard to make sure that the worst doesn't befall people on Medicaid. But my comment is that Medicaid is not a charity program. It is literally our insurance plan for lower income residents of this country, children, pregnant women, seniors in nursing homes, the disabled. These are people the insurance industry doesn't want to cover, and nobody can afford their product anyway. The ACA did nothing but actually subsidize the insurance industry and pour more public dollars into a private, system. So my comment is I fully support making sure that we stave off disaster for people in the near term, but that we really need to look forward and fix this for everybody so they can't slice us up into different demographics and work on a state-based universal single-payer system and then a national single-payer system, meaning everyone is covered, everybody's in, no eligibility requirements, no requirement to be in poverty to qualify. End of sermon on that, but that's the bigger fix is fix this for everybody.
Agreed. As somebody mentioned in the chat, we have until July 4th. They're really pushing this. So I appreciate many of the things that people are saying. There's a lot of things in the healthcare world that are incredibly important that have to be deal with. I'm talking about 4 people in Minnesota need to flip their votes on this bill, period. When we're in the small group discussions, that's what we should be talking about. We have until July 4th. And to stave off, as Anne said, stave off disaster. So I'm going to, okay, I want enough time so we can get into smaller groups and talk about some of these things. And I really want people to share their ideas. So what we're going to do now is to break out into these groups of, are you a healthcare provider who provides direct patient care, hands-on patient care, frontline worker, whatever you want to call it? Are you a healthcare provider who is in public health, administration, billing coding, whatever? You're kind of seeing people from a different perspective. Do you represent patients, and are you a patient? Are you a caregiver or family? Or are you somebody who's like, I don't identify with any of these groups. I just know that this all sucks and I want to do something. And so the question that I want the groups to come up with to answer, and then we're going to share with everybody, and then we're going to get all this information back to the individual groups is, what are the messages and approaches that will activate people in your communities to put pressure on their legislators? And specifically, what are things that you can do within your community, and what are the things that you need help from outside of your community to kind of help? And your community, I'm going to let you define that. I'm not defining communities for you. But the idea is that they're the people around you. How can you help them put the pressure on. So we're not the ones doing the pressure because I think everybody on this group is going to tell their legislator vote no. We want everybody else out there to tell their legislators to vote no. Okay, I'm going to so I am actually pretty decent at PowerPoint. I am not good at breakout rooms. So I'm going to open all the rooms here. I'm not going to assign them because I don't know your particular affinity. So I want you to assign yourself to a breakout room and just go to where you feel comfortable and you feel like you want to share your voice and share your perspective. And we're going to do this for probably 20 minutes or so, and then we're going to bring back and share it all. So it's going to be a good solid time in the breakout room. All right, everybody, welcome back. Thank you. So what we're going to do in the next few minutes is just share some of the discussions from the various breakout rooms. And to basically give everybody a sense of, number one, what is it that they can do? Number two, what can they bring back to their indivisible groups to say, here's a proposed action, or this is something we can do. And so that's really what I want to get out of this, so that this is like, it's not just us, it's more than us. So I'm going to just kick it off with my group. I'm going to self-deputize myself because I don't know, I guess I like to talk. But what we talked about was, obviously there's the conundrum of several of us are in the Twin Cities and there are folks in the more kind of rural communities, and what do we do? And also there was this challenge of this individual person of like, okay, I email somebody, and nothing happens. And so we talked about was this idea of, yes, you should email and call people. Calling is a little bit better. If you're not comfortable, email, that's fine. If they're your representative, but what are the multipliers that we should be using to get more people active? And so things like writing a letter to the editor, to your local paper. There's still just enough time to do this. Getting people in whatever community groups, churches, community groups, whatever it is that you're around, getting in front of them for a few minutes and saying, hey, this is what's going on, or in your workplace. I think it's getting time to protest the various indivisible groups. They know how to protest. Maybe we have people show up at Emmer's office or across over a bridge and just start yelling. And then for those of us in the Twin Cities, stories. And then two is, we can throw money around if we can. And, Indivisible has a campaign to get some, the national group has some money or a campaign to get money for billboards for the purposes of defending Medicaid. So those are just some things we talked about. So anybody from the indirect provider group, did you all talk about anything to add to this?
We did talk a little bit about trying to figure out how to exert pressure on we have kind of one rural district that we have some common ties to, and hope to figure out how to make pressure on Brad Finstad, but we're a little bit struggling with what's going to make the most impact, and how to exert that quickly too. That someone suggested resist bot, which I wasn't really familiar with, but as a way to maybe get some multiplier effect in that.
Yeah, resist bot. I mean, just making sure that even just those of us who are invested just call every day and clog up his phone line for a few minutes, that kind of thing. And then I do think if there's any if there's any opportunities for forums in that district, any kind of gatherings, anything to get in front of would be a good option. All right, so anybody from the group representing patients, what are things that you feel you would need, and what are things that you feel you would like to try to do?
Well, we discussed writing editorials in rural areas, doing TikToks.
Hmm.
There's one person that already is blogging, coming up with openers for conversations with people that you know directly. And then, like you'd mentioned about community groups, central space town hall, mini town halls, and anything with food to bring people together, potlucks, barbecues. And I think for my Indivisible group, I'm going to be working with Kurt, hopefully, to bring back some ideas and kind of, like you said, push up, push out.
That's great. Those are all great ideas. And the community, and it sounds like it's like community building first and then pushing out. And there is time for getting some of these forums together, getting people's voices, and then having like a phone-a-thon. I don't know if you have a barbecue to get everybody to take out their phone in one moment and just call, and then you can go eat your food because it's
That's
delicious.
cool.
Oh, I like that idea.
Yeah.
Okay. All right. From the caregivers, families piece, and I think yeah, I'm just gonna be quiet there. But caregivers and families, anybody from that group want to chime in? What you all talk about?
Well, I know at the very end, I kind of brought up a similar idea of like, oh, like, has anybody had any like personal like experience with like success in like hosting a gathering at your house where it's like, hey, you can come to my house today. I'll have snacks, whatever, and I'll help you contact whoever. I'll help you write this letter. I'll help you make that phone call, whatever it looks like. Just because a lot of people might not know how to do those things and would like that extra support and guidance from somebody who has experience. I also mentioned, I know you've been talking about not sharing stories so much. I find personally, as being a younger parent and being surrounded by a lot of people who are able-bodied, working, have private insurance, and don't have kids, that they generally just don't know what Medicaid does for kids like mine. And so, it really, for me personally, just promoting, activism from our friends, from our family, from our community. I have had positive experiences in sharing our story and saying like, hey, like, did you know, like, if we didn't have Medicaid, like our child couldn't go to therapy anymore because we can't afford it. Like it would just be too much. We couldn't keep a house over our heads then. It would be choosing between the two. That's what Medicaid does for our family. And they genuinely just don't have any idea, especially that younger demographic. I did emphasize like I feel like that younger voting demographic tends to get left out of like the
Mhm.
focus of conversation,
Hmm.
especially that like 18 to 22 range,
Mhm.
their
Yeah.
brain's not fully developed. They don't know what's going on in the world. They're still trying to figure out who they are. So they really do need more information and guidance from a reliable source. And they're still learning what it's like to exist outside of their home, away from their
Mhm.
parents. So they really do need somebody who's able to like connect with them on a personal level and say, hey, like, like for me, I have an easy time connecting with younger people because I'm close in age to them. So it's easy for me to like, hey, I know you don't have kids yet. Guess what? I'm not that much older than you. You might have a kid one day. You might need this stuff one day. You could get in a car accident tomorrow and need this. This is important. And I know you don't care about it yet, but at some point in life, you will have
Mhm.
opinions about this.
Mhm.
Absolutely. I
As
love
Mhm.
the.
as a
Sorry,
oh
go ahead, Marilyn. Go
yeah,
ahead.
as a follow-up to that, Carolyn McGuire was in our group and she reminded us that in the chat, she posted a couple screenshots of her phone enumerating the economic impacts,
Mhm.
loss of services to people who aren't on Medicaid, don't know
Hmm.
anybody on Medicaid,
Hmm.
think Medicaid has nothing to do with them, and yet
Yep.
we're all part of a system. And when this big contributor to the system gets eliminated, the system is going to significantly feel the shocks. So I thought that those were excellent things, and I am going to amplify those on my social media and under the title, so you think you don't care about Medicaid. Why is Medicaid important for me? I'm not
Yeah.
old, I'm not sick, I don't have kids. So I think it's important
Mhm.
to get that message out.
Yeah, that is really great. I mean, so much was mentioned about rural hospitals, but also um, the clinics I'm mentioning, county hospitals. But the reality is, you cannot suck out $800 billion out of our healthcare system and not have like colossal impacts across the board in terms of job loss, the consequences of job loss. It's these ripple effects. So that is right on. And I'm glad you brought that up. And again, remember, the point of this is for us to kind of make note of these things that people are commenting on and go to our Indivisible groups and say, these are things we could be doing. So Addie, like, I love this idea of saying, really destigmatizing Medicaid to a certain extent and say, I'm going to tell three friends that the reason that they get to hang out with my kids is because they're alive because of Medicaid. I mean, just there's a stigma, and destigmatizing that, which is what you and Carolyn are doing, is really powerful. Sue, I think you were going to say something, and I'm Sue Everson.
Oh,
No?
no, I think
Okay.
I
You looked
thought
like
so.
you looked like you were going to say something.
No, I'm just writing down things.
Okay. And then lastly, the fired up group, which was pretty big. I like big fired up groups. I realized we probably should have had two fired up groups or maybe three, which is a good problem to have. But what was the tenor of the conversation? What were some things that were talked about there?
Should I go?
Well,
I
I think Rebecca, you go ahead, or Ann, either one. We've
I
had a
mean,
lot of conversation.
I took some notes. So we talked a lot about rural hospitals and how we can um put some attention there, even to the point of like meeting with rural hospital administrators and or doing rallies in front of the hospitals, because um, when a small town hospital or a rural hospital closes, it affects everybody in the area, regardless on whether they're on Medicaid or not. So that could be one way to put some pressure on, and to find similarly with nursing homes and these institutions that are important to communities. We talked about writing letters to the editor. We talked about the fact, I can't remember who it was now, brought up the fact that even these it's not directly Medicaid, but enhanced premium tax credits that small business owners may take advantage of now to cover their employees are potentially going to be cut, which would have a huge impact. The thing that you shared, Mike, with the different kind of insurance cards and just some sort of information campaign about helping people to understand whether they're on Medicaid or not. And then because there may be a lot of people who don't realize, and that if they actually knew, then maybe they could be activated. Also, someone brought up, I think it was Kay, looking at the big employers in the area and kind of putting pressure that way, which would be more of an untraditional way of doing advocacy, because if they won't be able to find employees if they can't provide insurance. Let's see. And then also we thought it was important to remind people when we're talking about this topic that there really isn't that much waste to cut. So if the GOP is saying, well, this is all about cutting waste, that's not really true. Talking to church groups, sharing stories. Yeah.
Great.
Anybody else can jump in too if I missed anything.
Well, just a quick, using AI, of course, Googling who's paying for hospitals to stay open. I didn't look at nursing homes. Slightly over 50% of funding for hospitals comes from Medicare, Medicaid, and Children's Health Insurance Program. Without those programs, and Medicaid is 20%, these hospitals will close. That affects everybody. To somebody's point about whether or not you are personally relying on medical assistance or Medicaid, doesn't even matter, because if these programs fail, if they're taken away, the system fails for everybody.
Absolutely.
And
Lisa,
Also,
put your hand up.
We're in this together. We're in this together. You know?
Yes.
That was sort of the point I was making
Right.
about talking to the big businesses too. It's
Right.
not just
Right.
about paying the insurance. It's about that they won't be able to get employees in that area if there isn't quality of life.
If
And
you
one of
have
those
no
things is medical
healthcare
care
facility.
and hospitals.
Well, even the wealthy won't be able to write a check to get care that they need, especially at an ER.
'Cause
As
it's
we were
not
saying
there.
in our group, without, the ER is the only place by law you can't turn people away.
Yes.
And so the hospital eventually absorbs the cost, and that
Yep.
doesn't get paid. And it's only a matter of time before they close. And so people have to drive further and further out for care.
Right.
So a
Right.
true emergency,
Right.
even if you have a triage situation,
Mhm.
minutes, seconds matter. And
Mhm.
like I said, you can't write a check to get
Mhm.
treated quickly and promptly. And I was saying to our group too, even getting airlifted, like LifeVac and
Mhm.
ambulance rides, all Medicaid. I mean, mostly Medicaid, I should say. A lot of first responders, like who work within like EMS and paramedics. I mean, that's Medicaid that covers that too. So, in fact, I just looked at the bill for my son's ambulance ride recently, and it was like, oh, yeah, Medicaid listed right there. Medicaid paid
Medicaid.
for it. Hmm.
So we're almost out of time. Lisa, I know you had your hand up. Why don't you go ahead?
Yeah, this will be quick. One thing that came up in our group was when we were talking about the hospitals in rural areas is that, and it may have been Anne who may have mentioned that apparently that the group that you all are working with has a list of the hospitals that are vulnerable to being closed. And maybe that's something we should share with everybody, and try to get that information out to those communities so that they know that their hospital is at risk. I think that would be really important to share with everyone.
Yeah,
Yeah.
Right.
we don't have a list, but there's a site called American Hospital Association site, and there's underneath that rural hospitals at risk. And I believe they do have state by state an actual um, list of hospitals who are financially in trouble and without public funding will fail.
Addie, you're the last hand up, last person standing. Well, not really, but like we got. And then
Thank you.
go ahead.
I will go fast, I promise. So, just kind of building on the conversation on like rural hospitals shutting down, and also tying that in with, you got to tie it to the money that makes it matter to people more than anything. I'm actually from Texas originally. We moved to Minnesota 4 years ago. And it is at first, I was shocked at how the healthcare system is significantly better here. And I've been significantly shocked, and when having conversations on the importance of MA, how there's a lot of Minnesota residents who don't actually understand what it looks like to be underfunded for MA. They don't understand what it looks like to not have those rural supports. I lived in the country in Texas. Rural areas are typically for emergency services like paramedics, first responders. Those are volunteers, and it might take anywhere from 30 minutes to 2 hours for them to get to you, unless you just happen to have a well Medicaid funded area, which is very few and far between in Texas. So I have a lot of personal experience with that, and I mean, I have a lot of just firsthand knowledge, and just I can give you examples of how this happens and how it can go so wrong so fast. So I think tying it to those states that don't have the kind of state funding and programming like Minnesota, just using those as example is really effective.
That is great, and that's a good place to end, because I'm going to challenge everybody here to take some of the things we talked about and commit to an action. So whether it's that would be a really compelling story, Addie, to tell on that the website that we're going to share, because that is something that is not talked about enough. If it's talking to an Indivisible group about having action, like a protest, a rally at a rural hospital, or a series of them, just to inform people that they're about to lose their job, and that's a problem. Or if you're in a community and you want to meet with a faith group or a business or something. So I really urge people to commit individually, and then also commit to go back to your indivisible groups and said, hey, I was in this meeting. This is the information I got. We're going to collate this information. We're going to share it, both my slides and the links and all of the things that we talked about. Put it together, get it out to all your groups, and then we got to act. We only have a couple weeks left. So thank you so much for your time, for your energy. And I really, really appreciate everybody coming together on this. And then let's keep going on this. So thank you so much. Take
Thank
care,
you.
everybody.
Thank you, Mike and
Thank
all.
you.
Really good.
Thank you.